to the Conception Channel podcast.
Hello everyone, welcome to the Conception Channel podcast brought to you by the Being Fertile program and Yinstil Reproductive Wellness. I am your host, Spence PENTLAND. And today I'm excited to be here with a very special guest, Mike Berkley from New York. Welcome to the show, Mike.
Oh, thank you very much. It's great to be here, Spence.
Excellent. I'm excited about today's chat. Mike is going to help us go through common conditions that people are faced with when struggling with fertility and frame them from a biomedical standpoint, the diagnosis, mechanisms behind the disease and treatment, and then we'll look at the same thing through TCM lenses or traditional Chinese medicine lenses. So you can kind of get an understanding by the end of this podcast of, you know, the condition that you might be faced with and how both Western physicians, or your family doctor or IVF specialist and a TCM reproductive health specialist would approach your case and help support you. So, and we'll get into some highlight, times maybe when surgery might be an important thing to choose, and when IVF or PGS, ICSI, these things are wise to recommend, and then when TCM is strong and lifestyle components really play a role. So, without further ado, we're going to jump right in. Mike, if you want to give people a little bit of a background, that would be great so they have some idea. I mean, Mike's been doing this, I'll give a little, for over 20 years, working with women and couples trying to start their families in New York. And he's close with many of the REs or fertility specialists in and around Manhattan. I know that. And he's contributed so much to our profession, the traditional Chinese medicine profession, with his knowledge and forward movement with being the first or the pioneer, to really focus his medical practice in the reproductive health side of things. So, Mike, I'll tee that up for you, but now you give people a little background.
So it's great to be here. Thank you so much for having me as a guest. I'm honored. I think you really said it all. I've been in practice for 21 years. Really the first practitioner in the U.S. to specialize as an acupuncturist in the treatment of fertility disorders. Acupuncturists generally treat everything, from headaches to neck pain to fertility. I just decided to go into fertility and kind of do that, and that's what I've been doing for a long time. I guess my philosophy of conception and those who are facing fertility challenges is that it takes a village, and that patients shouldn't just see a reproductive endocrinologist because they can't really improve egg quality or lining quality or sperm quality. We can, often, not always, and they shouldn't just be seen by an acupuncturist, because an acupuncturist can't do a hysterosalpingogram or a fluid ultrasound, or if necessary an IVF. So therefore it behooves the patient to create a team of support personnel, meaning reproductive endocrinologist, acupuncturist, herbalist, psychologist if necessary. So my feeling is it takes a village, and that's a very important way to go.
Awesome. Yeah, I couldn't agree more. I just moved to a new town, and I'm amassing my medical referral village for the women and men that I see for reproductive health concerns. I just met with a pelvic floor physiotherapist and a psychologist last week, and the RE here in town is absolutely fantastic. So it's exciting to create that village, and I agree. It's everyone has their specialty, and today it's TCM, or traditional Chinese medicine, which is an acupuncture, which is Mike as well as my specialty here. So we're going to dive right into specific conditions and work through them one by one. If you ever have questions, we're going to leave how to contact me, but also Mike's contact, because we're here to help support in any way we can. But to start with, Mike, do you mind jumping right in?
No, I'm happy.
Okay, great. Awesome. So for advanced maternal age, and I am going to couple that together with egg quality, just because that is what every woman will hear, especially when they see reproductive endocrinologists or their IVF doc or fertility specialist. So from a Western medical standpoint, can you kind of talk through what the diagnosis and mechanism behind that they'd be facing when they walk in there? Yeah.
So, so there's a bell curve. People can see me?
Yeah. Yeah.
So let's just say it starts here and then it goes over here. So here's 13 years old and here's, 52 to 54 years old. And then there's this curve on top, and on top is 34 years old. So you start menstruating here at 13 years old. This is textbook. Some people start at 10, some people start at 16, but just textbook. Start menstruating at 13, you can start getting into menopause at 52. And then on the top of the bell curve is 34 years old. So from 13 to 34 is the most fecund time in a woman's life. Fecund meaning the ability to conceive in any given month. And from 34 to 52, the ability to conceive starts to diminish. It doesn't diminish in a straight line, so the listening audience, you don't have to worry if you're 35 or 36 years old, but it starts to just diminish, like this. And so what happens physiologically is that a woman loses 1,001 eggs every month from the time she starts menstruating. 1,000 eggs become atretic, which means they just die. This is every month, and 1 egg is ovulated. And so over a woman's lifetime, she's typically going to ovulate 500 times. And, plus or minus a little bit, depending upon it. Mm-hmm. But so obviously, once a woman gets into 35, 36, 40, 42, she's in this state that reproductive endocrinologists call advanced maternal age, because once you're past 34, 35, you're still a young woman, but you're in the category of advanced maternal age. And what does that really mean? It means that, and by the way, this statement is not universal. It means what I'm about to say is applicable to many women, though not all women. So it means that when women are past 35 years old and they're trying to get pregnant and they cannot, trying to get pregnant in the natural form using intercourse, timed intercourse, and they cannot, why not? Why can't they get pregnant? Well, typically, there are many reasons why they can't, but we're going to stay in the conversation in the category of advanced maternal age.
Yeah.
So what happens is the woman has fewer eggs, and therefore there's a reduced potential for a sperm to penetrate an egg because there aren't as many eggs left. Okay. Second of all, there's something that covers an egg, which is called the zona pellucida. And the zona pellucida gets more, what's the right word? It gets more durable. It gets harder in substance as a woman ages. And that means that a sperm may have a difficult time penetrating the egg, getting through the zona, because it's a little harder now. Right. So that's over here. And over here, as a woman gets older, her eggs are likely to become more and more aneuploidic, which means chromosomally abnormal. And so it doesn't mean she won't conceive, because she has eggs.
Right.
She probably has some normal eggs. But what happens to a woman who's older, I'll give you an example using money. So I'm wearing a pair of jeans. Let's say a woman's wearing a pair of jeans and she's 19 years old. She has 90 dimes and 10 pennies in her pocket. I'm speaking from America, so I don't know if you guys use dimes and pennies. It's the same in Canada, but
no more pennies.
Okay, so we still have pennies.
Yeah.
So she reaches into her pocket. Every time she pulls out a coin, it's a dime, because she has 90 dimes and 10 pennies.
Yeah.
It's very rare that she pulls out a penny. But as a woman gets older, it gets reversed. She has far more pennies than dimes. Every time she reaches into her pocket, she pulls out a penny. Mm-hmm. That penny is a bad egg.
Yeah.
And so what you have is a case with fewer eggs and fewer good eggs. So from the perspective of traditional Chinese medicine, well, I think I'm going to talk about Chinese medicine in the context of Western medicine, and you'll see what I'm going with.
Yeah, perfect.
So when that woman with diminished ovarian reserve and poor egg quality goes to a reproductive endocrinologist, she's done several intrauterine inseminations, they haven't worked. The doctor says, fine, let's do an IVF. They do the IVF, it doesn't work. Why not? Because the reproductive endocrinologist is only able to use what the couple presents with. So when the doctor retrieves eggs and fertilizes them with the sperm, if the eggs are not good, the woman's not going to get pregnant, or she's going to get pregnant and she's going to miscarry. Or she may get pregnant and there may be some abnormality, for example, Down syndrome. And then she has a choice to make as to how she's going to proceed, whether she's going to abort or carry to term. And so how now, because there's no answer in Western medicine for improving egg quality, sperm quality, lining quality. We'll talk about lining later, but what do the Western docs do for lining? They do transvaginal Viagra. And, it helps a little, doesn't really help a lot. It's a Band-Aid approach. But getting back to the egg quality. So I read recently, sometime last week, that eggs, this is in a Western medical journal, eggs actually need nourishment. Now, I don't know why that's such a big new concept, but that's a new article. And they said eggs need nourishment. So what does that mean? I mean, you're not feeding your eggs a hamburger. What does it mean to nourish your eggs? Well, it means that you have to feed more of the stuff that your eggs are already getting. For example, let's say that, I eat a steak 3 times a week. Well, I can't be eating that much steak. It's not going to satisfy me. I need a bigger piece of steak. So when you're nourishing an egg, what does that mean? It means that blood from your heart beating, the circulation that's manifest in the human body, is delivering blood all over, from your eyebrow to your pinky to your nose to your ovaries. Right. And why is blood flow to the ovaries important? Because blood carries FSH and LH from the brain. It carries electrolytes. It carries nutrients from the food that we eat. It carries oxygen from that which we inhale. And also, blood is like a taxi cab, so it takes all these good things to the eggs, and what is it? It drops them off, and what does it pick up? It picks up dead cells, which are called debris, because all the time our cells are dying and being regenerated. Right. But sometimes these dead cells can cause what's called reactive oxidative species, free radicals, and that's quite damaging to eggs and the whole ovarian milieu. And so not only does the blood flow carry the good things, the things that I mentioned, to the ovaries and the follicles and the eggs inside of the follicles, but it helps get rid of the debris, the dead cells. Now, that's happening every single minute that a woman takes an inhalation. I mean, as long as a woman's alive, that's happening. Why? Because her heart is beating and stimulating blood flow through the system. But what acupuncture and herbal medicine do is they improve and enhance hemodynamics. One proof? I'll prove it to you. So, let me just clarify. So what does that mean, improve
hemodynamics? Yeah.
Hemodynamics. It simply means improve blood flow. That's really all it means. And so any acupuncturist can say anything. Any physician can say anything. But here's the proof. So if you take a woman and you perform, I can't do it, it's out of my scope, but if a medical doctor does a transvaginal ultrasound with a colored Doppler, see ladies, every time you have an ultrasound, you can see the information on the screen, it's all gray and black and white, but there's another type of ultrasound that uses a colored Doppler, and you can see color on the screen instead of just gray. So you take a woman, you do a transvaginal ultrasound, and it gives you a number, which is called the uterine artery impedance index. And let's see, the higher the number, the less blood flow there is. And so what happens is you do acupuncture on this woman. And by the way, this has been done. I mean, you can look it up or Google it. You do acupuncture on the woman. 10 minutes later, you do another transvaginal ultrasound with a color Doppler, and you see tremendous blood flow and perfusion, all kinds of blood flowing to the uterus and manifest in the uterus. Why is that a good thing? Well, number one, you're increasing blood flow to the uterus, so you're going to help with implantation issues. And number two, and that's not so important, because most infertility is not about implantation failure, even though sometimes that is the case. But certainly that blood flow is being fed to the ovaries as well. Why? Because there's one artery called the uterine artery, and that feeds the uterus. But at the end of that uterine artery are these branches that branch off to the ovaries and feed the ovaries. And so the woman, under the care of acupuncture and certain herbs, will get a greater delivery of oxygen, nutrients, hormones, electrolytes, and a greater excretion of dead cells. So you're taking a garden, you're adding more water, taking out of the weeds, cutting down the trees that are blocking the sun. What do you expect as a result to happen? The garden is going to flourish, and it's going to be beautiful. And so that's how acupuncture helps to improve egg quality and improve uterine lining issues.
Beautiful. So as you said, from backing up, I love that analogy. The first teacher I ever had in Chinese medicine used the analogy that in Chinese medicine you're a gardener, trying to balance all the various natural phenomena, like heat and cold and wet and dry, and otherwise you go to med school, you'll become a mechanic more and view the body and as a sum of its parts, not in a holistic perspective. So you said for egg quality, realistically, so many women that have difficult responses, or when they're over a certain age, will just get that diagnosis from their physician usually, right?
Yes.
Poor egg quality, especially if they've had difficulty responding to an IVF, right? So, but what you mentioned Viagra may be one way to bring. Is there any other Western medical treatments that you see commonly used?
Well, so they use Viagra so sometimes what happens is, okay, a reproductive endocrinologist wants to see a woman with an endometrial thickness of 10 millimeters.
Right.
Before they do a transfer. Now, there are many documented pregnancies on 7 and 8 millimeters. There are documented pregnancies on 6 millimeters. I don't think there are any documented pregnancies on 5 millimeters. So if a woman has got a 6 millimeter lining, first of all, many times nobody knows why that is. But what the doctors will do is they'll give her transvaginal Viagra. And, Viagra brings blood to the area.
Right.
And so I think it helps minimally. And by the way, I don't want to give the impression, because it would be the wrong impression, that if a woman has a 6 millimeter lining and you do acupuncture on her and give her herbs, that you're going to necessarily get her to a 10 millimeter lining. That's complete nonsense. But you might get her from a 6 to an 8. You might get her from a 6 to a 7. Right. And so I think that the difference between acupuncture and Viagra is that Viagra is more of a Band-Aid approach. Yeah, it's bringing more blood flow, and so is the acupuncture. But remember, the acupuncture is trying to facilitate the energetics and the activity of the whole organism, the whole body, to create an environment where blood flow is a naturally enhanced thing, or the enhancement of blood flow occurs naturally. Right. And listen, there's nothing wrong with taking Advil for a headache. I have nothing against Viagra, but I think you take Viagra and the effect lasts for 3 days and then it goes away again. Mm-hmm. So when I treat patients, I'm treating them twice a week until they get pregnant, and twice a week for 13 weeks after they get pregnant. So if I'm working on them for a lining issue, they're coming in twice a week. Their lining is going to be improved at the time they get a transfer.
Yeah, right. And okay, so I've seen, if it's in a frozen embryo cycle or something as well, estrogen or estradiol might be used to help with the lining, suppositories. But from a traditional Chinese medical perspective. Oh,
because I'm sorry. Let me just interrupt you for a second. I apologize.
Sure. Yeah, no.
But this is important. Sometimes the lining is not as thick as one would like it to be, right, because estrogen receptor sites are downregulated. And so you can give a patient all the Viagra you want and all the estrogen you want, and it will not help. And so when you use acupuncture and herbs, and again, I want to state clearly, I'm not one of these people that thinks that acupuncture and herbs are the answer. They are not. They are part of the answer. And so, but the point is that if you have downregulation of estrogen receptors, acupuncture and herbs may be more efficacious than Viagra or 81 milligrams a day of aspirin or estrogen, because acupuncture is working at a deeper internal level than just using 2 milligrams a day of estrogen.
So then acupuncture may be facilitating more than meets the eye. Like the thickness of the lining may be just a piece of the picture, and there may be more that we're not seeing. You might have an 8 millimeter lining and that's fine, but if you're utilizing acupuncture, there may be more to it. And often when you work with an acupuncturist, they may talk about a little bit about diet and some other things in your life that may be inhibiting, proper formation or just function of the overall organism and digestion, so the blood is properly getting, manufactured, etc. Is that
so I have to tell you that let's see how to present this. So I have to tell you that I'm at odds with many acupuncturists.
Yep.
They know that, and that's fine because I'm not necessarily right. They could be right, I could be wrong. I don't hold much value. I don't think there's much value in dietary recommendations and lifestyle recommendations unless there's a value. and what I mean by that is, if you have a woman who comes in, she's 35 years old, and she works out 3 days a week, and she lives pretty well, but she eats a bacon, lettuce, and tomato sandwich or a hamburger twice a week, I'm not going to tell her not to do that.
Right.
It's fine. Now, if I have a patient who's obese and who smokes cigarettes, I'm going to tell her she needs to change her diet and her lifestyle.
Right.
But I don't think every single patient is a necessary recipient of lifestyle and dietary counseling.
Agreed. Agreed.
I think being sedentary is a big issue. People sit down all day, they sleep all night, and what does that mean? What does that cause? Right. It causes impedance in the blood flow.
Right. Because
activity stimulates the blood flow.
Right.
So I think that women should exercise, either yoga or hardcore exercise. It doesn't matter. However, make sure not to lose too much weight.
Right.
Because you need to have some weight to be fecund.
Right.
But anyway, I'm sorry if I digress.
No, that's perfect. I mean, I think that speaks really well to, you've got experience in reproductive medicine, and I think that is why it's important to seek out, an acupuncturist or Chinese medicine practitioner that does, because certain conditions as well require maybe more lifestyle change than others, and every one of the cardinal, components of traditional Chinese medicine should be an individualized approach, as what you're saying. So there's no protocol here. It's like not everyone should be on a damn keto diet or anything. Every woman should be, and man should be, looked at individually and approached in that way, and that is important to understand about Chinese medicine. So thank you for highlighting that. There's what's the famous saying in 10 people with the same condition can receive different treatment.
One disease.
Many treatments.
Many treatments. One treatment, many diseases.
Right. Yeah. Exactly. So that's a good. Okay. So you get into. So there may be some diet and lifestyle components, but I mean, that's great for advanced maternal age. Do you mind if we move forward into something that's quite different, actually, at least in my experience, and I'm curious to see what you have to say, and it's something that I see more of than almost anything else in my practice is unexplained infertility.
Sure.
So Western medical standpoint, how can you come to this diagnosis or lack thereof? I'm not sure how to put it.
Yeah. So what happens is a 30-year-old patient is trying to conceive using timed intercourse, and she's trying to conceive for 2 years, and she can't. So she goes to a reproductive endocrinologist, and the doctor checks the husband's sperm, and the sperm is fine. Right. And he checks the woman out fully, and she's fine. Right. And so that's unexplained infertility. Infertility is defined as the inability to conceive after 12 months of trying. Right. And so she's in the game for 2 years. She hasn't been pregnant, and there's nothing wrong with her. Right. And she can't get pregnant. So that's unexplained infertility. So I want to say a few things about that. So Perfect. Remember that we're in 2018 right now. And we meaning, the educated, intelligent people, we think that medicine is cutting edge. But I put to you for your consideration that most medicine is not cutting edge. And we're in 2018. What's medicine going to look like in 2028? What's it going to look like in 2050? The diagnostics that we have today, or that Western physicians have today, are only as good as the diagnostics that they have today.
Right.
So I'll give you a perfect example. A woman is going to do an IVF transfer, and she does a pre-implantation genetic diagnosis on her embryo, and it's a beautiful embryo with no inclusions and no fragmentation. It's just a beautiful embryo, and they transfer the embryo, and she doesn't get pregnant. Why not? I don't know. I don't know. And neither does the reproductive endocrinologist. Now, why don't they know? They don't know because their diagnostic tools, of which there are many and many good ones, but their diagnostic tools are limited.
Yeah. And
next year and in 10 years, they'll be less limited. So that's the Western perspective of unexplained infertility. We don't know what the heck is going on, and we're going to just keep doing IVF until it works. So in TCM, there's really no nomenclature. There's no word. There's no concept of unexplained. Right. In traditional Chinese medicine, every pathology is always explainable. And why is that? It's always explainable because we diagnose patients differently than Western medical physicians do. We diagnose by asking a lot of questions, feeling the pulse, looking at the tongue. And so what happens in Chinese medicine, we ask a lot of questions about everything. You know, is there shortness of breath? What's your urination like? What's your defecation like? What's your stress level like? Do you love your job? Do you hate your job? What's your sex life like? What do you eat? We ask everything. I literally probably ask 100 questions during an intake. Yeah. And then what happens is you take these questions, and I'm just being, I'm making an analogy. I'm not being literal. You know, you take these questions and you paste them on the wall, and you start to see connections between a lot of things. And then you draw a line to all these connections, and then guess what? You come up with a diagnosis. And then you treat according to your treatment principle. You have a diagnosis, and you have a treatment principle, which is your map to treat, your guidelines to how you treat, and then you treat. Now, the patient listening to this podcast may say, "Oh, well, I don't get it. It doesn't make sense, et cetera, et cetera." And I would say to that patient, "You're right. You know, I wouldn't get it either, and it doesn't make sense. It wouldn't make sense to me either." But what the patient has to understand is there's more than one language in the world. Some people speak English, some people speak French, some people speak Chinese, Russian, Japanese. There's different ways to communicate, and different ways to approach a medical dilemma, a medical challenge. Western medicine is one way to approach it. Let me just let the listening audience know something, that 3/4 of the world, 3/4 of the inhabitants of this planet, 3/4 currently today use Chinese medicine. They don't use any other type of medicine except Western medicine. So, for example, the oldest medicine in the world ever is Ayurvedic medicine. That's 10,000 years old. But it's really only used, or it's 99% used in India. But traditional Chinese medicine is used all over the world. So why am I saying this? Because if it wasn't beneficial, if it wasn't working, it wouldn't be used by 3/4 of the world's population. And so listeners who have doubt, I just want to tell you this. You've done your 5 or 6 IUIs and you've done your 3 IVFs. Try something new.
Right. What you just brought up is why I chose to study Chinese medicine. Because I'm like, even a culture like the Chinese that are so infused with tradition in their culture wouldn't bang their heads against the wall for 2,000 years with something that isn't effective, and it wouldn't have spread to every corner of the globe. You're right. There's Chinatowns and herbal shops and acupuncturists everywhere, and I that's such a great point. The guideline or the map that we use to identify what to do with patients, our system of diagnostics may have you. We call pattern identification. I love using that word with patients because it seems to resonate. You know, no one is void of pattern or patterns because we're alive and breathing. Just like if you're an adult, there's certain things that are going to be going on. If you're a child, there's going to be certain things. If you're an elite athlete, there's going to be, certain conditions, you're going to be battling more than someone who's, in a corporate
Yeah,
office job, right?
There's no such thing as homeostasis.
Right.
Homeostasis means perfect health.
Yes.
There's no such thing as homeostasis. Homeostasis is really, a theorem.
Right.
That's it.
Yeah.
So everybody has a pattern.
Yeah.
You're right.
So we're going to find out what any traditional Chinese medicine practitioner will find out what your goals are. And in reproductive medicine, it's most often a baby. And so then we find out what would need to happen for you to bring you closer to the balance that has been seen to be most often effective over time, over the millennia, to restore fecundity or to restore fertility. And we move toward that. Doesn't mean that that's exactly where every woman's going to need to be, but we move toward that. And depending on the patterns you have in life, it might be a different journey there.
Absolutely.
Absolutely. Okay. So Unexplained, that was great. So could we move into PCOS or Polycystic Ovary Syndrome, another very different clinical picture?
Yeah. So PCOS is an interesting thing. I guess for those of you who have it, you already know what it is. For those of you who don't have it and want to know what it is, it's where a woman, well, actually it's quite confusing and may require some explanation, but I'll just start at the basics and then I'll contradict myself. So it's really women. Let's do it this way. Polycystic ovarian syndrome indicates a group of women that don't ovulate, that are anovulatory. And there are other women that don't have polycystic ovarian syndrome that also don't ovulate, but they don't ovulate for different reasons. So what happens in the PCOS patient is there's something in the brain called luteinizing hormone, otherwise known as LH, and it's pulsatile. So it just goes up and then it goes down, and an hour later it goes up and it goes down. Every hour it goes up. So women with PCOS, their pulsatility of the LH happens quicker than the hour. I don't know the time, but let's just make believe it happens every 20 minutes. Right. So they're constantly getting this high level of FSH, which is luteinizing these follicles, but the follicles could be 6 to 8 or 6 to 9 millimeters. When a follicle is mature and a woman ovulates, it's 20 millimeter follicle on a natural level. Right. So these are 6 to 8 millimeter follicles that get luteinized as if luteinization helps to the LH goes up and then the woman ovulates. Right. But what happens is because her eggs are very small, the LH goes up, but she doesn't ovulate. So this is called luteinized unruptured follicle syndrome, otherwise known as LUFS, L-U-F-S. And so she develops all these cysts in her ovaries. And it's a very big and complex disorder. So not only does she have cysts on the ovaries, but frequently the PCOS patient has hyperinsulinemia, elevated testosterone levels. There can be hirsutism, which means hair, a lot of hair on the face, the breast, the thighs, the stomach.
Acne.
And PCOS it's a spectrum disorder. Right. So there are some PCOS patients that ovulate every month and they're totally fine. That's over here. And over here, these women have clitoromegaly. They lose their hair. Their breasts diminish. They look like men. They have beards almost. I mean, they're never going to get pregnant. And that's all the way on the other end of the spectrum. I've never seen a patient like that in 21 years. But the typical PCOS patient is anovulatory. And so the typical course of treatment for that patient is to give her Clomid. And then, there's many ways to do it, but you can give her Clomid in intercourse. Right. Or you can give her Clomid in insemination and see if that works. Now,
Clomid is a Western medical prescription.
Yeah, Clomid is clomiphene citrate. It basically makes the woman ovulate.
Right. Yeah.
And
most often,
what happens? The other thing I wanted to say is that women with PCOS frequently, though not always, have elevated testosterone levels. And testosterone is an anti-estrogen. And estrogen does two things in a woman. First of all, the follicles emit estrogen. But interestingly, estrogen also nourishes the follicles. And so in the ovarian milieu, in the ovarian environment, you have some estrogen. You also have a little bit of testosterone, androgen, which gets converted into estrogen. But what happens in the PCOS patient is they have too much testosterone, and it's an anti-estrogen. And what does that mean? It means that the eggs are not getting nourished enough from the estrogen because they're being kind of blockaded or overcome by the testosterone or the androgens. And so what happens, in fact, is that PCOS patients are twice as likely to miscarry as the non-PCOS population because by the sheer fact that you have PCOS, it means you have poor egg quality. Unless your testosterone levels are normal. But if your testosterone is high, you automatically have poor egg quality. And so, now the interesting thing about PCOS, the other interesting thing, there's many, many different things, but 50% of the PCOS population are obese, and 50% are normomorphic, which means they have a normal, regular, average body. And so, the women that are obese are more problematic than the women that are normomorphic because obesity can also trigger the excretion of additional testosterone. So these women are very, I don't know the word, they have a lot of testosterone. And so that's a problem. So again, with acupuncture and herbs, and so these women are amenorrheic very frequently. They don't even have a period. So the main goal in this patient is not to get her pregnant because you're never going to get her pregnant. What you have to do is you have to regulate the period. Because once the period is regulated, then the ovulation is regulated. And then she can go to work. And here's I guess what I want to say, which is, really about keeping it real for me. If I met a woman on the street who had PCOS and she didn't ovulate and she wanted to get pregnant, you know what I tell her to do? I tell her to go to the doctor and take Clomid and have intercourse and do a couple of IUIs. It's easy. Why should she come to an acupuncturist twice a week and spend a lot of money on acupuncture and herbs? Listen, it's like this. When I have a headache, I don't have some acupuncturist needle me. I take 2 Advil and I relax, and my headache is cured. When you have a PCOS patient that doesn't respond or is called refractory, they don't respond to the Clomid or to letrozole, which is another type of medication, or even IVF. Why not? Why aren't they responding? Well, they're ovulating because they're taking Clomid or they're taking letrozole or they're taking gonadotropins, injectable medication, right? They're ovulating. So why aren't they getting pregnant? Again, because of the egg quality. So it's the same case as I mentioned before, except it's a little different. If the patient is really just under your care, our job, is to help regulate the period, which automatically regulates the ovulatory cycle or ovulation, and in addition to doing that, driving blood flow to the ovaries, follicles, and eggs, so you can improve the egg quality.
Yeah, polycystic ovary syndrome. It's that metabolic storm, which is code for everything's kind of out of balance hormonally for the most part. Insulin levels, cortisol levels, FSH, ALH, which you were explaining.
One other important thing I just want to mention really quick,
no problem.
which is really interesting. And I don't mean to make it too confusing, but remember in the beginning I was a little confused because I didn't know where to start, but I do know where to finish. So there are many PCOS patients that do not have polycystic ovaries. So when you have polycystic ovaries, that's a physical finding. But you can have PCOS in the absence of physical findings because you can have what's called biologic PCOS, which means that your LH is 3 times higher than your FSH, and you have hirsutism and elevated testosterone, elevated insulin, but your ovaries look normal, but you still have PCOS.
Right. And that may often be the atypical PCOS, the more normomorphic, which you referred to, not the obese patient. One caveat I do want to say is that in my experience, with if it is something that people want to address and they're maybe younger and they realize a few things like, there may be a genetic component which might, they pass down to their offspring, and the chance of miscarriage, like you said, is higher as well. If they do want to come, and work with traditional Chinese medicine for some time, or even with themselves, diet, lifestyle, it's like a type 2 diabetes scenario. It's a condition that's quite treatable, but it requires a lot of commitment and time. Is that your experience as well?
Absolutely. I mean, look, one of the differences between Western medicine and Chinese medicine is that in a certain sense, Western medicine, and listen, I always tell people without Western medicine, we'd all be dead. Yeah. I'm a huge proponent and a huge fan of Western medicine. Sure. I go to the doctor, okay? Yeah. So I'm not knocking that, but I think I lost my train of thought. I'm sorry. But in any event, there's nothing much that a doctor can do except make you ovulate and, do an IUI, do an IVF. Right. Under the care of acupuncture and herbs, you can potentially, not infrequently, menstruate regularly, ovulate regularly, and probably even more important than that is improve the egg quality.
Right. And adjust maybe the underlying mechanism that is adjusted at least to a point where you change the trajectory of the woman's health, that over time maybe insulin sensitivity returns and testosterone levels maybe come down some, and it's like the management of that. I use the type 2 diabetes because it's a very similar condition, right? So I the first thing that I think is important for a PCOS patient to understand, if they do want to stick in that natural realm and they're not listening, when someone says, well, just take Clomid, do an IUI, is that there's going to be some time and commitment involved.
Oh, that's what I wanted to say. Yeah. Western medicine has spoiled patients. And what I mean by that is you go in and get a prescription. And that's the level of your commitment. That's it. You get the script, you get an exam, and then you just take the medicine, and you're fine or you're not fine. But in Chinese medicine, you have to commit to going once or twice a week, sometimes for a year, right. Sometimes for 3 months, sometimes right. for 3 weeks, depending upon what you're treating. But it requires participation on the part of the patient. And look, don't be lazy. If you want to get in shape, you got to get yourself to the gym. If you want to learn how to play the piano, you've got to practice every day. Right. If you want to get better, sometimes it requires your participation.
Yeah, sure, of course.
That's the train of thought that I lost, and you brought it back.
Yeah, cool. Yeah, just that commitment level. PCOS important. So let's dive into endometriosis quickly. Diagnosis, Western medical treatments, and how TCM would reframe and try to treat that, or if it can or can't.
Okay, so that's endometriosis is a fascinating subject. So first of all, it's an autoimmune disorder, and I have a lot to talk about with endo. I'll try to keep it succinct. Mm-hmm. So first of all, it's an autoimmune disorder. Right away, immediately, any woman that's trying to get pregnant with endometriosis should do a reproductive immunophenotype panel, which is a panel that determines if the woman has any other autoimmune issues, including those that can cause blood clotting. And that's very important to note because there are many autoimmune issues. There are many times that women will have autoimmune markers, but they don't express the autoimmune disease. For example, lupus-like anticoagulant. This is a type of a blood clotting, a type of thrombophilic disorder, a blood clotting disorder that can cause blood clotting in the uterus. And this can cause second or third trimester miscarriage, it can cause stillbirths, and even sometimes, and not often, it can cause infertility. And the woman will have no signs or symptoms at all, but yet it can mitigate her chances to get pregnant. Activated natural killer cells, protein C, protein S. There's many different autoimmune issues that can mitigate one's ability to get pregnant. And if a person has endometriosis, they may have other things that should be looked for. So that's a very important point.
First step, okay.
Yeah, now the other thing is there are some reproductive medical doctors that don't believe in they don't believe that autoimmune issues can mitigate fertility, and there's a whole other group of reproductive endocrinologists that do believe in that. And my suggestion is do the test, because what have you got to lose? You're going to spend some money and get the test. I'm not asking you to get open heart surgery. Get the test. It's a blood draw.
Right.
And then if you have these things, why not treat them? If you haven't treated them before, you treat them, and then what happens is you get pregnant and have a baby. Anyway, getting back to endometriosis, it's an autoimmune disease. And by definition, endometriosis means the endometriotic tissue belongs where? It belongs in the endometrium. the top layer of the uterus. And so by definition, endometriosis means ectopic deposition of endometrial tissue, meaning endometrial tissue is in your nose and your lungs, on your ureters, in the cul-de-sac, on your bladder and your rectum. It can be all over the place. And what happens is these deposits of endometrial tissue respond to hormones that estrogen and progesterone, and just like when a woman is menstruating, these depositions of endometrial tissue, in a sense, they're menstruating too. They bleed, they cause scar tissue, they invaginate the tissue, meaning they dig into the tissue, they contact nerves. It can be extraordinarily painful. The other interesting thing is that the mean time to diagnosis for endometriosis is 11.6 years.
Right.
So women can be 30 years old, have, by the way, unexplained infertility. Because frequently, endometriosis is completely asymptomatic. Right. A woman can have stage 4 endometriosis all over the place, and have not one single symptom. Conversely, if you took a pen and just hit it on a piece of paper and made that very little dot, she can have that much endometriosis and have severe, debilitating, agonizing pain every month, premenstrually with menses. Yeah. So there is absolutely no point. Okay, so first of all, let's go back. As an acupuncturist, what should we be asking every patient that comes in? Well, this is what we should be asking. When you're menstruating, do you have severe debilitating pelvic pain? Yes or no? When you're menstruating and you move your bowels, do you have rectal pain? Yes or no? Do you have severe debilitating pain when you're ovulating? When you're vaginally lubricated and you're having intercourse, do you have pain with deep penetration? Now, if the patient answers yes to 2 times out of those 4 or 5 questions, I send her to a laparoscopic surgeon for an evaluation. The only real way to determine, well, there are 2 ways to diagnose endometriosis. One is a lucky way and one is not so lucky. So the lucky way is you get an ultrasound and you see an endometrioma, which is a tumor made of endometriotic tissue on an ovary. Right. So bang, you see that on the ultrasound. We know the patient has endometriosis. But what if she has a couple of these symptoms, but you do an ultrasound and you don't see anything? Well, that doesn't matter, because she can have endometriosis in the cul-de-sac, which is around the rectal area. You're not going to see that on a transvaginal ultrasound. Right. So in fact, a very good doctor who's checking for endometriosis will do a rectal exam, a digital rectal exam. Many doctors, if not most, don't do that to women who they suspect has endometriosis. Okay. Why do you do that? Because the cul-de-sac is an area, if I remember correct anatomically, between the uterus and the rectum. If I'm correct, but it's down near the rectal area, so there can be endometriosis there. That's why she has pain when she's menstruating, when she defecates. Yeah, yeah. So if you do a digital palpation up there and a patient that has endo in the cul-de-sac, she's going to scream. So it's a very difficult disorder. Now let's talk about how to treat it. So once you send the patient for a diagnostic workup to a laparoscopic surgeon, and the surgeon finds that she has endometriosis, one has to realize that a laparoscopy is both diagnostic as well as
treatment.
Therapeutic.
Yeah. Mm-hmm.
No, it's diagnostic as well as therapeutic. So once the doctor's in there and they see it, they're going to go ahead and operate. And they're going to resect all that endometriosis. Oh, by the way, let me step back for a second. So I had a conversation with a reproductive endocrinologist recently, who I respect and I like very much. He's a dear friend of mine. He's a very smart doctor. He says to me that endometriosis doesn't cause infertility unless it causes tubal damage. And I completely disagreed with him and told him that. Why does endometriosis in the absence of tubal damage cause infertility? Well, for many reasons. First of all, it actually affects the uterus, even though endometriosis by definition is a disease that happens outside of the uterus. Right. How does it happen? Because these endometriotic depositions secrete something called pro-inflammatory cytokines. For lack of a better explanation, these are inflammatory products that find their way where? They find their way into the uterine cavity. So, the testicles are 1 degree less in temperature than the rest of the body. That's why the testicles are outside of the body. I don't know the temperature of the uterus, but the uterus must have a static temperature or a temperature range. So when you have pro-inflammatory cytokines in the uterus, it's heat, it's inflamed. and it's not a proper environment for production, and she's not going to get pregnant. Now, where can an acupuncture get involved in treating the endometriosis patient? Is there a place for acupuncture in the endometriosis patient? The answer is yes. Now, 2 minutes ago I said we can't treat it. So I'm going to just take that clay and reshape it a little bit. You send the patient for laparoscopic resection, and she does that. She's fine. You still must do acupuncture on her and use herbs to clear heat and down. I don't want to get too technical in Chinese medicine. You want to use anti-inflammatory herbs. Why? Why? The doctor already took out the endometriosis. Here's why. Because endometriotic tissue can be purple, brown, black, red, but guess what? Some endometriotic tissue looks as normal tissue. And so even when a woman has a laparoscopic surgery, there's probably a 95% chance that she still has some endometriosis in the body, but the doctor can't visualize it.
Right.
So I always assume that she does. And I don't give her very cold herbs because that'll mess up the stomach and cause all these things, but I give her some cooling herbs, and I use, certain acupuncture points. I don't want to get too technical. Gallbladder 43, liver 2, these certain spleen 10, liver 8, these things that can clear heat from the body. So my proposition to acupuncturists is treat the patient with endometriosis after she's had a laparoscopic resection.
Right, right. Well, in a lot of other ways, there'd be opportunity to optimize the fertility in that patient as well, because they're also told as soon as they have that laparoscopy that the next 3 to 6 months are a fertile window for them. So they're excited and hopeful and ready to come for acupuncture probably anyway.
Yeah,
so
indeed.
That's fantastic.
But the one thing, just for the patients to remember, is speak to the doctor about a reproductive immunophenotype panel. You know why? Because you can have all kinds of things that are undiagnosed, and you get the endo out, and you're still not getting pregnant.
Right, right.
Because you have other things that haven't been diagnosed.
Usually where there's one autoimmune, it's a breadcrumb.
It's very frequent.
Yeah, very frequent anyway. Okay, so I know you could go on about endometriosis for a long time, but I want to skip quickly into recurrent pregnancy loss or miscarriage.
Sure.
And something that's, there's not a lot out there for, but maybe a good segue is the autoimmune paneling as well. I'm not sure what your thoughts are there.
Right. So chronic recurrent miscarriage can be caused by many things. It can be caused by undiagnosed disease, for example, endometriosis, or let's take a polycystic ovarian patient who she does ovulate, but the eggs are no good, so she has a chemical pregnancy.
Right.
She gets pregnant, she constantly miscarries.
Right. Advanced maternal age.
Advanced maternal age, which basically translates into egg quality again, so she's miscarrying. Sometimes it's implantation failure. Sometimes it's very interesting. There's crosstalk between an embryo and the lining. They talk to each other. And they have to talk to each other just like you and I are talking to each other. There has to be a mechanism for communication. Right now we're doing this on computer. We could do it on the telephone. We could do it in person. But if we're just not connected, we can't talk to each other. So it's the same thing with the uterus and the embryo. So sometimes the uterus, the uterine lining, is not in sync with the embryo. And so this may require an in vitro fertilization because you have to transfer the embryo at a certain specific time when the uterus is receptive. Right. And there can be uterine problems. There can be Asherman syndrome, which means you have scar tissue on the uterus. That's something that's not an acupuncture issue. That's a surgery. The good news about Asherman syndrome is that 99% of the time it makes the uterus fine and you're going to be okay. But let's talk about chronic recurrent miscarriage as a result of poor egg quality. It just goes back to the very beginning of our conversation. We have to improve the eggs, the egg quality. Oh, and by the way, we keep talking about egg quality. The egg quality could be fine. It could be sperm quality.
Right.
And listen, an embryo takes 3 things, right? It takes sperm. It takes 2 things, sperm and an egg. And then they make an embryo. Right. So unless the sperm is great and unless the egg is great, you'll get an embryo, but it won't be a good embryo. And so you'll have a chemical pregnancy. You'll miscarry at 4 weeks or 6 weeks or that kind of thing. Right. And this is why, by the way, I will never treat a woman ever unless her husband has had a semen analysis or unless they promise to get one.
With recurrent loss or just period across the board?
No, period. I mean, if it's an infertility case, I will never treat them unless they get a semen analysis. Because, listen, it could be either that they both have pathological presentations that can be worked on, or it could be that the woman's totally fine.
Right.
And it's the guy.
Right.
So that's a very important thing for acupuncturists to know as well as for patients to know.
I give an amen to sperm quality and miscarriage or fertility in general, but it's still, there's still such debate of how much sperm contributes to fertility period, and unfortunately men aren't going to carry the pregnancy, so they're further shuffled aside, as well as there being very little treatment from biomedical technology for sperm or pharmaceuticals, so they're shuffled aside again more there. So that is a place where acupuncturists have a lot that they could contribute.
Yeah, men with sperm anomalies are very they do well with acupuncture nerves unless they don't, meaning they have very serious issues.
Right.
They have a microdeletion of the Y chromosome, or they have a severe varicocele, or they had a what is it called? The tubal a vasectomy.
Right.
This kind of thing. So those are quite difficult cases, sometimes impossible cases. But if you get a guy with no history of testicular trauma or surgery, and those are usually idiopathic. There's usually no known cause. The guy just has very low sperm count, or he has, another big thing in men is sperm DNA fragmentation.
Right.
And what happens as a result of that is it can't penetrate the egg. So what do doctors do? They do ICSI, intracytoplasmic sperm injection, where they inject sperm into the egg. But my feeling about that is, if the sperm has DNA fragmentation, it might have some other bad things too. And so you're injecting a poor quality sperm into the egg. Maybe she gets pregnant and has a great baby, but maybe she doesn't, because you're forcing a square into a circle. So men with DNA fragmentation are very good candidates for acupuncture.
So okay, that's a great segue, because I think now I want to wrap it all together. I mean, there's other things we could chat about a little bit more in depth, but IVF or assisted reproductive technologies, IVF, ICSI, and the like. What conditions, the reproductive health conditions respond well to IVF treatment, and what places where we are just talking like the male factor would acupuncture Chinese medicine really be able to contribute and help support, or be an alternative?
So you're asking me, just to make sure I understand, which female
let's start there.
Cohort will do well with IVF, and which male cohort will do good with acupuncture?
I'd just stay with the female to start. Yeah, we kind of touched the male side.
Fine.
That's maybe a separate topic anyway.
Yeah, okay. So look, here's the thing. A woman needs to have an embryo in the uterus.
Right.
And the embryo needs to invade the uterus, which is called implantation. And sometimes it just doesn't happen because, for whatever reason, the sperm doesn't penetrate the egg. And let's back it up. Let's back it up altogether. The woman has blocked tubes.
Right.
No, let me restate again. She has scarred tubes.
Okay.
Scarring on the tube, on the fallopian tubes. She's never going to get pregnant. She has to do IVF. So that's a perfect reason to do IVF.
Yeah.
Scarred tubes. Let's say a man has very low sperm count. That's a good. Let's say a guy has 3,000 sperm. He can't get her pregnant by ejaculating into her. So you take one of those sperm and you create an embryo. You mix the sperm with the egg, you create an embryo. That's a perfect reason to do IVF. Now, there are other reasons to do IVF. In these unexplained cases, sometimes you retrieve an egg, fertilize it, take the embryo and put it in, she gets pregnant. Right. Even a PCOS patient, many of them do well and have babies with IVF. Look, I think IVF is a very good tool. There's been about 4 million babies born as a result of IVF. 4 million babies. So that's nothing to sneeze at. I think IVF is a good thing for patients that can't get pregnant, but I do think it should be a stepwise approach. If you're not getting pregnant, get worked up, get evaluated, find out what the underlying pathology is. You have scarred tubes, the husband's sperm is no good, your uterus is 4 millimeters, the lining is 4 millimeters. Find out what the issue is, then go in and and start with IUIs, unless the husband has very low sperm. But if the sperm is decent, do IUIs. Do, 4 or 5 of them. And then, if that doesn't work, try an IVF. So I think IVF is good for any patient that's not getting pregnant. And I believe in IVF, and I believe in IUIs. I just think, so the patient may say, the person watching this may say, then why should I get involved in acupuncture? Because what if the IVF constantly doesn't work, which is very frequently the case?
Yeah.
Why isn't it working? It's not working because you have bad egg quality or bad sperm quality or bad uterine lining quality. And the physician can do nothing for you, but we can.
Right.
And so that's why it takes a village.
Awesome. I love that. Well, I think that's a great place to wrap it up, Mike. It's true. It's why there's the village. It's why that, I, like you, have become really great friends with REIs in my hometown. And it's great that to see live in a time where at least some of the ego is being taken out of medicine, and we're working toward the common good of the patient, and that's happening like wildfire in reproductive medicine, and because of people like you, and I know this is a quick hour.
And you.
Well, thank you, Mike. But this is a quick hour, but we could go on and on. Maybe we'll split these topics up a little bit more, so people can get a little bit more in depth about Chinese medicine and have a little bit more of an idea, because it is that unknown, and it is a little bit weird, and it's different. It's not what we're used to for the most part. And but for the sake of everyone listening today, I trust that you got some great pearls and a deeper respect for acupuncture.
Spence, I just want to say one more thing for the listening audience.
Perfect.
Ladies and gentlemen, just remember what I'm going to say. This could be the most important thing that I've said.
Okay.
Acupuncture nerves will not ever hurt you. They will either help you or they won't, but they'll never hurt you. So there's nothing to fear. So that's the last reason that that you should not come in.
Right. So if there's a possibility they'll help.
Indeed. Only got upward potential.
Yeah. There you go. Awesome.
Yeah.
Well, Mike, we will be back, I am sure. I always enjoy our time, and I know we're going to hang out here this weekend. The coasts come together. I'm excited that you'll be on the West Coast soon.
Hey, can I give my email, my website?
It'll all be in the show notes, but yeah, please, how can people get a hold of you? It'll be in the show notes, but go ahead.
Fine.
No, for the listeners, some people might just be listening.
BerkeleyCenter.com. BerkleyCenter. BerkeleyCenter.com.
BerkeleyCenter.com. And email, no. They can get you from the website. Yep. Of course. Awesome. So check out, Mike's been in Manhattan forever, and he is the man that really pioneered and built the Trojan horse. I think I've used that analogy today. I don't know, but
very kind of you. Thank you.
Yeah. And keep up the good work, Mike. And we look forward to having you on the show again. And good luck to everyone listening and watching on your journey.